Do you or someone you know suffer from knee pain?
Perhaps you've been told you have knee osteoarthritis.
If so, you are not alone. A lot of our clients over 55 suffer from knee osteoarthritis, and often it stops them from doing the things that they want to do with the people they love.
In this video, we're going to run through what it means to have knee osteoarthritis, reassure you that you can improve and get back to doing the things you love, and we're going to show you some exercises to improve your symptoms, your strength, and your overall health.
Okay, mate, let's get into it. Okay, mate, so what is knee osteoarthritis?
Well, the medical profession used to think that the pain and stiffness from knee osteoarthritis was the result of wear and tear from too much use and too much loading. This is based on an inaccurate analogy comparing the human body and the joints to those in a mechanical object like a car, where the joints need regular oiling and eventual replacement after years of use. In fact, the opposite is true. The human body and the joints actually adapt to loading, making them more resilient and better able to handle the stresses of daily life.
Okay, so a better term rather than wear and tear might be age-related change. So when we have X-ray findings such as minuscule tears, cartilage thinning, maybe such things as bone spurs, we can see these as normal age-related findings, which we find more of the older we get, even in asymptomatic populations. So therefore, X-rays do not correlate well with pain and dysfunction.
So your imaging findings are not the be-all and end-all, even if you're in a lot of pain right now. Although it can be challenging to get started, it's really important that you do, no matter how low the level is, because exercise is really beneficial for your knees, but also for your general health.
In fact, the Royal Australian College of General Practitioners, in their most recent set of guidelines, strongly recommended land-based exercise for people with knee osteoarthritis.
Now, any form of exercise is beneficial for your health and for your knees, but resistance training is particularly useful for building strength, improving your confidence, and your load tolerance in your knees.
Okay, so we're going to show you some exercises you can get started with. Alrighty, let's run through 3 exercises that you can be adding in to your current strength training regime during the week.
Now, it's important to remember that during these exercises, it's quite likely that you'll get some pain or discomfort at some point. The key thing is keeping that pain tolerable for you during the exercises and in the 24 to 48 hours afterwards. Doesn't mean you're causing any harm, we are just loading a sensitive joint, and we're going to show you some ways to modify the exercises to make them more manageable.
That's exactly right. And one exercise that we often modify for our clients is the squat. A lot of people with knee osteoarthritis say that they can't squat, but realistically, if you're hopping out of a chair, hopping off a toilet seat, getting out of a car, you're most likely doing that squat movement. So let's run through an exercise you can start with. So Ollie, do you want to jump in the chair for me, mate?
Yep.
So a sit to stand is a great way for most people to start, and you can usually find a tolerable level. So what we've done is stacked up a couple of cushions on one another, and Ollie's going to stand up from a bigger height there. Okay, so he's not very low. He can start by using his hands if he wants. He can also play around with his stance. So he might go a bit wider, see if that works. He might go a bit more narrow, see if that works. Excellent, just like that. Then if that's too easy, he can obviously start by not using any hand assistance. And then once that's tolerable, he can of course start taking away the cushions so that he's going a little bit lower, make it more realistic for a regular chair that a lot of people will sit in. And then once he gets good at that, of course, taking another cushion away for a full body weight sit to stand. Just like that. Excellent, mate. How did that feel?
Yeah, feeling good.
Good, okay. So the next thing we can do is do what we call a box squat. Now that is where we're basically going all the way down to a sit, but not putting all of our weight down. So do you want to demonstrate that for us, Ollie?
Sure.
So Ollie's just lightly touching the box, and this can of course be done with some cushions to increase the height there. Excellent. The next step would be doing a full squat. Okay, so taking away the chair, no cushions, all he's doing is a full body weight squat like that. And just keep in mind, you're allowed to let that torso come forward just like Ollie's doing there. That might make it a little bit more tolerable for you. Pick a stance width, okay, and a foot position which is right for you. So it might be narrow, you might turn your feet out and go wide. Whatever is gonna make it tolerable is the best thing.
Yeah, and once you've accomplished that, you can start to add a little bit of weight.
Yeah.
You might add a backpack, for example, with some books in it, or a dumbbell or a kettlebell that you might have lying around the house.
Excellent, mate. So that is exercise number 1, a sit to stand or a squat.
Cool, let's move on to exercise number 2.
Yep.
Something that a lot of people with knee osteoarthritis and knee pain have trouble with is going up and down stairs.
Yeah.
So why not prepare ourselves for that movement by training it?
Yep.
So nice and straightforward, there's not too much to go through here.
Yep.
Okay, starting with a nice low step, all right, going up and down, making sure that you are doing a controlled movement for starters.
Now, mate, of course, you could hold on to something like a rail, or you could have a chair there, okay, for a bit of assistance if you do need.
Definitely. Okay, now of course, to make it harder, we can increase the size of the step.
Yep.
So doing a bigger step. But once you're comfortable with that, you can add some weight. So you might hold on to a kettlebell. So we're increasing the force requirements of the exercise. You could, of course, also add a backpack to this one too.
Absolutely, and that's going to mimic a lot of daily activities. Let's just say carrying the shopping or some luggage up the stairs, which is pretty common in a lot of people's lives.
For sure. Okay, let's move on to exercise number 3.
Okay.
So the muscle strength at our hips can play a big role in our knees. So this one is going to be a glute bridge.
Absolutely, not only good for helping our knees, but also good for firming up our bottoms, ready for those budgie smugglers at the beach.
That's right, mate.
Okay, mate, so the first option is going to be lying down on our back, okay, with, just like this, okay, with a nice lift of the hips. Just like that. That's a fairly easy option. You could do this on the bed, you could do it on a couch, wherever that you have a flat surface, okay? Now, for a lot of people, that might be too easy as a start. So what you can actually do is elevate the movement, as Ollie's gonna do now. And you can put a pillow there if you'd like, or you can put your feet on the edge. So what this is doing is increasing the difficulty, okay, by putting his feet up on the chair. That's a slightly harder option. Now, what you can do if that's really too easy for you, mate, is go to a single leg glute bridge. And this is gonna be really, really tough. Okay. And of course, doing that up on the chair, single leg glute bridge, is going to be one of the hardest variations you can do. But once again, you have to make sure you pick a level which is tolerable and manageable for you. So there's a couple of variations of a glute bridge, which, as Ollie said, is really good for the hamstring and the gluteal muscles at the back there. Not only good to make you looking good in swimmers, but also for your knee.
So add these exercises into your resistance training program you're doing 2 to 3 times per week. We want you to do anywhere between 2 and 3 sets of 8 to 15 repetitions, depending on what you can handle and what is challenging for you.
Now remember, when you are completing the exercises, you may get some pain and discomfort, but this is very normal. Just remember, you are loading up a sensitive joint. If you give it enough time and keep consistent with the exercises, you'll hopefully start to see your symptoms lessen and your function improve.
Okay, so go and put these exercises into practice, and we will see you in another video.